I am Dr. Manish Sharma, Pediatric Intensivist, Jekyll Hospital, SMS Medical College, Jaipur. See, we are in a very bad state as compared to the worldwide statistics of organ donation. There are many countries in the world, America, UK, Italy, Spain, other countries which have a very high rate of organ donation. Organ donation is a very broad term. Here we are talking is cadaveric organ donation. That is the donation occurring from a brain death patient. In India, we are having mainly live organ donation. If somebody's kidney fails or any other organ fails, it is only his family members like the wife or the son or the child or the daughter, they give their kidney for that particular patient. Whereas world over now the scenario is changing for taking the organs from certified brain death patients who are actually dead but their organs continue to work for another 10 to 12 hours on artificial support, and these are the patients who willingly their attendants or they themselves in the past pledge that if they die, and if they die because of brain death, then their organs should be taken and given to the needy people. So what we require in India is a lot of propagation of cadaveric brain death. See, about a few years back, we don't have even studies. Every year in India, we have approximate 1,40,000 road traffic accidents happening. Of that 1,40,000 road traffic accidents happening, even if there are more than 70% of the patient who are actually dying because of brain death. Brain death is that when there is a time brain stops functioning pretty earlier, and then after 10 to 12 hours or maybe 24 hours the body dies. So there are more than 70% of these population which is brain death. So if you see, we have almost 1 lakh patients who die because of brain death, and if we extrapolate it to the organs which can be taken from one human body, we can retrieve 9 potential organs. So 9 multiplied by 1 lakh. So we have a capacity of every year donating more than 9 to 10 lakh organs to the needy population, whereas our rate is not even touching the 1% of what is actually required. Two systems which are more prevalent in the world, one is opt-in system and another is opt-out system. Opt-in system is when the patient's attendant say that they want to give their kids and kin's body for the organ donation. Supposing somebody dies, his family members say, okay, if he has become a brain death patient, you can retrieve the organ and give it to needy people. Whereas opt-out system, the government has made up a rule that every patient is a potential organ donor until he opts out from the system, which is there in Spain and many other countries. So they have a large pool of human organs which is always available. With every year, with the development of technology, the human race survival time, the longevity is increasing. The organs are going into more wear and tear. So everybody at some point of time, or many of us, will require organ because organ get tired up very earlier and body lives. So we in country which is still saying that we have a graying of India, we would be needing much more organs so that our people can survive in a healthy manner. In adult population, to certify brain death is very simple. There are 6 steps and they are straightforward steps. You do one test, if it comes out negative, there is a protocol of making 6 tests. If there is confusion, then there is quite 2 more tests which you do, but the result is pretty well, it's much easily readable. Whereas in pediatric population, the human brain, that is the pediatric brain, is not fully developed. So the tests which we do, they sometimes mix up, and it is very difficult to identify whether the symptom is going towards the brain death or actually the patient is alive and his brain is obtunded because of some insult. So pediatric brain death certification is quite tricky, requires a lot of training and sometimes more specialized equipment to diagnose a pediatric brain death. This is a very pertinent question. A lot of people ask me because I am working as a nodal officer for the state of Rajasthan for cadaveric organ transplant, multi-organ transplant. It is possible even a newborn can give his organs and these organs can be utilized in a fully grown adult. Just take an example of kidney. What happens is when the kidney, the first organ donation which we did in Rajasthan was a small child. He was a 5 years old child. His kidneys were transplanted in an adult patient. What happens is if the organ is very small or if the donor is very small, we do an en bloc transplant. En bloc is usually there are two kidneys which are shared between two recipients. But when the size of the organ is pretty small, then both the organs are implanted in one adult in one pouch which they create, and that is called as en bloc transplant, and it is wonderfully successful. The moment you join the kidneys, the moment the surgery is over, the patient starts passing urine, is absolutely fine. So any newborn, any pediatric patient can give organ and which can be utilized for the adult population. Especially the kidney can be utilized. For heart and other organs, you have to have a mix and match of the volume of the heart of the donor and a recipient. Technology is the pediatric population or the pediatric critical care or the pediatric medicine is a rapidly changing branch, because what we need in India as a country, what my thinking is that until or unless we are able to give this confidence to our population that even if you have one child or two child, the technology in the country is so advanced that we will be able to make your child live for his whole life, and the child will not die because of the simple illnesses. The people will automatically adopt for a small child family norm. What happens is that people in the past were having more children because they used to think that if you have 5 or 6 kids, even 1 or 2 kids because of some diseases expire, at least we will have 2-3 kids available with us. So in case if we are, and we have been successful in this with the government's lot of program, that now people are automatically opting for a small family norm. Pediatric population, pediatric medicine is a rapidly changing branch. There are a lot of equipments which come in because pediatric patient never speaks about his illness. You have to search the disease, the symptoms, and then you have to go for the sophisticated test which tell you about the disease process in the child. So we have to basically depend lot on machines for the diagnosis as well as management of the pediatric patients. I come from a government institution, luckily from state of Rajasthan, and our medical college hospital, that is Jaipur Hospital, if we visit, is one of the best hospital, one of the largest hospital in the country, with more than 900 bed strength of patients, beds available, and we have a fully equipped 50 bedded NICUs, 25 bedded PICUs, surgical ICUs. So whatever the new technology comes in, we have the video augmented EEG monitoring, we are doing OAE. These are the latest equipment which are not there even available in the corporate setup of in the state of Rajasthan, and we are doing in our medical college. So definitely the government hospitals and medical colleges are equipped, they have adequately trained staff, and if the government like ours government gives a positive support, we will definitely be in a state to do much better than the other people. In certain circumstances, PPP is a much better model, but in our state, we ourselves are doing it wonderfully well, everything in our hands, but definitely see, you cannot leave other people. If you have to survive, if you have to grow, you have to grow together. This discrimination between government and private, corporate and government should be vanished away from the medical health system, because at the end of the day you are dealing with treating the humanity, and the corporate as well as government should tie hands and do whatever best they can do for the survival and for the betterment of the human life.